All right. Thank you so much. Welcome to another episode of the Love, Hope, Lyme podcast. My name is Fred Diamond. I'm the author of Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. And of course, I'm the host and the producer of the Love, Hope, Lyme podcast. If you're listening to this on Apple, thank you so much. Go up and give us a 5-star review. We would greatly appreciate it. And if you're watching this on YouTube, thank you so much as well. Please subscribe, give us a thumbs up, give us a comment on today's show. Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor is free. The PDF, the e-version of the book, is free for chronic Lyme survivors. Jesse, Brooke, and Jennifer, I've given out over 1,500 copies of the Love, Hope, Lyme book. If you'd like your own copy, of course, go up on Amazon. It's available on Amazon. And a lot of people request signed copies that they then send to family and friends. Reach out to me via Facebook, LinkedIn, or at freddiamond.com, and we will send some signed copies to you as well. All right, I'm very excited for today's show. When I was doing the research for Love, Hope, Lyme, I discovered that there were communities out there on social media, in person. Every state, it seemed, had its own Lyme organization that would bring people together. And very commonly, they would have get-togethers. Of course, during the pandemic, that stopped for obvious reasons. And one of the organizations I had come across was Generation Lyme, Gen Lyme. And I was very intrigued by their model, bringing people together, providing meetups, and just basically bringing the community together to help each other get support, find answers, and basically provide some emotional support. We have the three founders. We have Jesse Rubin, Brooke Stoddard, and Jennifer Hoffman. Why don't you guys introduce yourself? And then Brooke, why don't you tell us why Generation Lyme was created? But Jesse, why don't you introduce yourself first, and then Jennifer, and then Brooke.
Sure. Thanks for having us today. We're very excited to be here. My name is Jesse Rubin. In my non-Lyme disease life, I am a musician and singer-songwriter. I tour all over the country and all over the world. And then a lot of my time is spent on Lyme advocacy. I was very, very sick from 2013 to 2016, was in complete remission for 6 or 7 years, and now am back on treatment again.
All right, I'm also fellow Philadelphian, so
That's right.
we learned that, and great to see you here. Thank you so much, and thanks for the introduction. Jennifer, why don't you give us a little bit of an introduction to yourself?
Hi, yes, I'm Jennifer Hoffman. I live in New York City. I've had Lyme likely since childhood, but I was diagnosed as an adult in 2017. I was reinfected in Central Park, New York City in 2020. I always like to add that because people don't realize that you can get it in a city. I'm a former professional opera singer. I now work in the nonprofit sector, and I'm also very active in Lyme advocacy.
Yeah, thank you so much. And that's a great point about in the city. I mean, we all know this, where people have gotten symptoms of Lyme. They've gone to doctors in Texas, North Carolina, everywhere. And they always get the doctor who says, well, we don't have Lyme here. And of course, we all know that that's a myth. As a matter of fact, most people listening to the show probably understand that as well. And in the city, in the middle of the busiest city on the planet, you believe you're reinfected. Well, thanks again for being here. Brooke, why don't you give us a little bit of introduction? And then Brooke, tell us why Gen Lyme was introduced and created.
Sure. Again, Fred, thank you so much for having us. My name is Brooke Stoddard. I live in New York City. I'm 40 years old. I work in finance, and I've had Lyme disease since 2010, babesiosis as well. I have fortunately mostly recovered, and it's been a dream come true to serve people in our community alongside Jennifer and Jesse.
Very good. So tell us why Gen Lyme was created.
Sure. So Generation Lyme is an independent 501c3 nonprofit organization, and it's dedicated to empowering patients and supporters facing tick-borne diseases. Our mission is to create a space where tick-borne disease patients and supporters can really feel welcome, supported, and uplifted. All of us know that Lyme disease can be really isolating, and Generation Lyme exists to change that. Generation Lyme has been serving this community for many years. In the early years, going back to 2017 and 2018, we did something that we think was really novel at the time, which was to create an Instagram account and to interview some really brave and trailblazing patients who wanted to share their authentic experiences with tick-borne disease via Instagram to create awareness and to kind of create the change that they were looking to see in the world. And so that was a way that we addressed needs of this community back then. And over the years, Jennifer and Jesse and I found, numerous additional ways to serve the community. And today we have a really expansive platform that offers 5 different services to tick-borne disease patients and supporters. And we're happy to go through them in depth, but they include meetups or online support groups, sharing patient stories, which is something we still do. We have resources for patients and supporters. We also produce a Generation Lyme podcast, and we produce and host community events as well.
Very good. So, Jesse, tell us a little bit about the meetups. How often do people participate? What types of people participate? Is it just for Lyme survivors? Is it people who want to know more about Lyme? Give us a little bit of a perspective on the meetups themselves.
So I think one of the great things about us is we are constantly evolving, adding and taking away meetups as we see fit, getting suggestions from the community. But it's really interesting to see some people have a favorite meetup that they go to every week, and they're a Thursday person and they hang out with other Thursday people, and that's their meetup. Some people come, we have meetups almost every day of the week, and there are some people who will come to every single meetup that they are qualified to go to. Our mission is really to help everyone impacted by this illness. So a lot of our meetups are for patients, but we also have a meetup for supporters. We also have a meetup for parents of children that have Lyme disease. But we also want to make sure that people are comfortable and included. So we have a meetup for women. We have a meetup for men. We have a meetup for the BIPOC community. We have a meetup for the LGBTQ community, college kids, an international meetup that's earlier so people in other parts of the world can join, a late night meetup for people on the West Coast. It's constantly changing, and it's really amazing to see. One of the great parts about it as a host is you get to see people come really at their worst. Often they're newly diagnosed, they don't know anything about the illness. And over time, you see them get better, you see them connect with other people on the calls. And that's really one of the biggest reasons we do meetups, is just to connect people together so they have a support system outside of our meetups. And as an organization, we've been doing this for 4 or 5 years now, and we get to see like different generations of people come, they get better, they leave, they miss us, they come back. It really can feel like a family and a really close community. I think the meetups are the best thing we have.
So, Jennifer, what are the benefits of being part of a community like this? Obviously, y'all came together and you're having hundreds, if not thousands of people participate. And that's actually one thing that really surprised me. Prior to doing the research for Love, Hope, Lyme, I had no idea that there were communities of people getting together with this disease and all the co-infections. So talk about some of the benefits there are of being part of a community like this.
I'm very happy to talk about that because there are just so many benefits. We know community and connection is beneficial and helpful to everybody and anybody all the time in life to feel okay, let alone survive and thrive. So when you're dealing with something like an illness, whether it's acute or a long-term form of Lyme or another tick-borne disease, or you're the loved one of someone who has it, it's so important to have some people that you can ask questions of and get answers to, because you're dealing with something that the medical community and public don't understand very well. So you need people who are going through it that you can talk to. It's also so helpful to be in a room with people who can look at you and say, I get it. I've been there too. I'm there right now. You're not crazy. You can connect, you can get answers. You can know you're not alone. How many of us who have dealt with this, either as a patient or a supporter, have felt alone? Feeling alone is very dangerous. It's scary. It's horrible. And we exist as Generation Lyme to get rid of that feeling, because no one should ever go through Lyme alone, and no one has to. And because of us, this is just what we're trying to do. It doesn't have to be through Generation Lyme that you get this support system, but we want to do our part to create the ability for people to have that. So Community enables you to have a support system, to have something to look forward to also, and to just be able to just let out whatever you're going through. So yeah, whether it's coming to a meetup because you're having a bad day or coming to a meetup because you're having a great day, we want to create a space for people to just be and be accepted.
That's powerful. Brooke, I'm curious, is there curation behind the meetups? Do people just kind of gather and whoever starts talking, or do you guys manage them, or they're group leaders? How does the formal process look like once people get online?
Yeah, of course. Jesse did a brilliant job explaining that some of the meetups that we offer, for example, on Wednesday, Thursday, and Saturday, are for anyone. But we also offer dedicated meetups to specific members of our community. And so we have almost 12 different types of meetups. In the past 5 years, we have hosted over 1,000 meetups for about 11,000 people. And we believe that it's critically important that a meetup should exist almost any time that someone would like to attend one. And so that's why we have almost one per day. We had 300 meetups last year. And so the way these meetups work is something else that's really important that I'd love listeners to know is sometimes it's difficult to take that first step and to come to an online support group, which really just means a Zoom call, a Zoom room. And so if you're coming for the first time, I'd love for you to know that you can participate in any way that you're comfortable with. For example, we have members of the community come to meetups and they have their camera on. Other people have their camera off. Some people like to talk a lot, some a little, and not at all. We actually have many attendees of meetups who are simply there to listen, and that's their way of participating and feeling support from the community. So I think my shorter answer to your question is there's so many great ways to kind of get the value of community from one of these meetups. Just show up in the way that's the most comfortable for you.
All right. So Jesse, what are the most common things people are asking each other in the groups? Jennifer mentioned that people come on a good day and they come on a bad day. Just talk a little bit about what are some of the conversations like? Are they looking for doctors? Are they looking for answers? Are they looking just to be in a group of people like them? Like one of the things that we all know about the disease, and Jennifer mentioned this, it's a very lonely disease. Any chronic illnesses, particularly chronic Lyme and dealing with the co-infections. Most people don't know what you're going through because the old, you look good type of a thing, what could be a problem if you look as good as you do? So Jesse, give us some insights into what are people talking about?
So first of all, the short answer is yes, they're talking about all of those things. We have two types of meetups. We have a topic meetup where we have a topic of the month, and then it's more of an open discussion. Where it's more of a sharing portion where people talk for 2 or 3 minutes about the monthly topic, whatever that means to them. And that's really more of a space for people to just let out their stuff. And then on Wednesdays, which is what I typically host, we have what's called a burning questions meetup. And that's more of a casual discussion. I don't have to call on anybody. I'm really just there to facilitate and mute people who forget to mute themselves. And on those calls is really a time where we wanted to give people that are impacted by Lyme an opportunity to connect with each other, because as we know, Western medicine doctors are not always the best resources for Lyme patients. So if it's a new person who just found out they're diagnosed and they sort of don't know what they're getting themselves into, and they come on like a deer in headlights, and very often it's, does anybody have any treatment that's worked for them? Does anybody have a doctor, right? You get these beginning questions. When there are people that have been sick a little bit longer, it starts getting into more symptom stuff, but also relationships and the emotional side of it and the impact of this. Like it's not just the physical symptoms, the mental and emotional aspect of this illness, on top of a medical community that doesn't believe you, on top of maybe you can't work, maybe your self-worth and your value is in the toilet and you're trying to figure out your purpose in the world. There's a lot of victim blaming that goes along. There's a lot of ableist language in the world that can make people feel guilty. So a lot of it is people sharing their experiences and just trying to get the point across of like hearing what they're saying and having people just say that they get it is really, really important. But anything you can imagine, doctors, symptoms, medications, relationships, it all comes up because this disease impacts every aspect of your life.
Yeah, I'm just kind of curious for all three of you. Do you ever delve into controversial topics? Let's say if somebody says, "Hey, has anyone tried this particular type of treatment that maybe is leading edge or controversial for whatever reason?" I'm just kind of curious. Like, does the topic ever get into down, to some places that maybe would be, for lack of a better word, controversial?
I'm
Brooke?
happy to take that one. And it's a great question, Fred. When we started hosting these meetups alongside an incredible group of volunteers who host these meetups, we really wanted the meetups to be places of non-judgment. And so people, we all know, have very individual experiences with tick-borne infection. And I might have a personal experience with it that I get to share at a meetup, but it doesn't mean that my experience is better or worse or more constructive than someone else's. And so what I think that all of us do well as participants or hosts of meetups is really listen to the different aspects of treatment or symptoms or experiences with the medical community that every person has. And we try to keep it there. We want this to be a place where people can talk about what is on their minds, what they are going through. And we find that to be really valuable in what is oftentimes a very lengthy, sometimes multi-year experience with tick-borne infection. The one other thing that I'd love to add too, because Jennifer touched on this earlier, is I would say one core theme that we often hear from meetup attendees is these meetups are sometimes the only places where they feel like other people around them understand what they're going through. And that's really powerful. I mean, all of us have friends and families and coworkers, and when we explain to them what we're going through, they obviously do their best to understand. But if they don't have a tick-borne infection, they might not directly understand. And so it's pretty awesome when I go to a meetup and there are 10 other people there who have Lyme or maybe other co-infections, and I say, you know what? My fatigue was really bad recently, and they know exactly what that means, because fatigue to people without a tick-borne infection means one thing, but inside one of these meetups, when everyone gets it and I don't have to explain it any further, that makes me feel so, so good.
But all three of you kind of gave me your introduction in the very beginning, but now that we're going through the interview, I'm thinking that I might have sold you all a little bit short on your journeys. I'm going to ask you, how has participating in this community helped you? It's an interesting point. Not everybody sees the value, or not that they don't see the value, they don't appreciate the value. It's probably a better way of saying it, of being in a community where you're in this world where not everybody has access to it. The example you used before, Brooke, about fatigue, prior to, and to let people know as well, most people know I do not have Lyme. I wrote my book, Love, Hope, Lyme, to understand what someone in my life was going through. And yeah, you have a tough day, make yourself a little dinner, sit in front of the TV, watch the game, then you're fine. I've met people who have said they've been in bed for 3 or 4 days straight because of the ridiculous fatigue that comes with a disease like this. And I've come to learn that the expression that some people use is, you don't get Lyme until you get Lyme, and you don't want to get Lyme. So I'd like to each to give us a little bit of perspective. How has the community helped you? Again, you've all given us a little bit of a taste into yourself. Jennifer, let's go with you first. Again, you all are the creators. Again, we're talking today with Jennifer Hoffman, Jesse Rubin, and Brooke Stoddard, the creators of Generation Lyme, or Gen Lyme. Tell us a little bit about how the community has helped you as, I'm going to broaden the question, as a Lyme survivor and as a human being. I'll give you a little bit of breath there to answer however you'd like, but I'm really interested in hearing, because it's actually quite remarkable. Again, in my business world, I'm a big networker. I have created a community of sales leaders, and what I do, I run the Institute for Excellence in Sales, but not everybody gets the value that can come with being part of something that you've created. So Jennifer, why don't you go first? How has this helped you?
Thanks. I could talk for a long time about this. I'm going to try to keep it short. And I'm actually going to start by saying that I'm not a creator of the original version of Generation Lyme. I am a creator of the more recent 501c3 version. And this is important to my answer to this question. So we've co-created this kind of newer iteration of Generation Lyme. And I joined Generation Lyme as a participant when they were holding in-person meetups, and I was reticent to do so. I was very isolated at the time. I didn't really know anybody until I met one person through Instagram who had Lyme disease, who convinced me to go to an in-person meetup. And that started me on a journey when they very quickly invited me on the board because I shared ideas and they were so warm and welcoming. But very long story short, we ended up creating something new together. But even more importantly than that, the experience of being a part of this community and working on this community with these people totally changed my life, not just with tick-borne disease, but comprehensively. I mean, I now know know what it's like to experience being understood in the way that Brooke talked about and that Jesse talked about. I mean, when I'm dealing with something that seemed like it was just me, when in the past I would have thought this is just me, no one else has it, it's something nobody else can understand. I know that there are hundreds of thousands, if not millions of people out there who get it, who can get it, who would get it, unfortunate as it is, and how powerful it is when we connect with each other, and how horrible it is to go through, but how healing it can be when we find each other and reflect each other. I also know I have so many more resources for advocating for myself. I have developed the tools to advocate for myself, to speak for myself by helping others and in so doing, helping myself. I've been in this community through a lot of changes in my own abilities while I've been very sick and gotten a little better, and then very sick again and gotten a little better. And this community has like been with me through all of that. And I also we worked in a group of 4 for years with Haley Tobias, and this was very, very, there was so much support even in our group of 4 that truly altered how I move through the world. And so that completely changed how I manage my own health, let alone how I manage everything else. And so I'm forever grateful for that.
Thank you so much, Jesse. How about you? How has this community, Jennifer gave us some great answers on how it's shifted her as a human being, let alone a patient or a survivor of a disease. Give us your perspective.
So when people ask me to describe Lyme disease, the way that I describe Lyme disease is it's an illness that takes any aspect of your life that brings you any joy at all, and it robs you of that thing. It's a systematic illness, not a symptomatic illness. So it attacks the different systems of your body, could be totally randomly. For me, there have been times in my life where, first of all, I will say that we've had a weekly call for 5 years now. Like, this constitutes one of my longest and most serious relationships in my life. And there were long periods of time, just selfishly, during the pandemic, and also now that I'm not working, where the only thing that I have on my schedule that keeps me sane and keeps me connected with other people is participating in Generation Lyme. I will say that when you are really, really, really sick, there's kind of 2 ways that you go. There's one way of, when I get better, I'm walking away and I'm never going to think of this again. And then there's the other path, which we have all taken, which is, this is so horrible that I'm going to vow to do everything I can to make sure that no one has to suffer the way that I am suffering right now. And so on a selfish level, the fact that we have built this thing to help people, and it is helping them in exactly the way that we wanted it to, is incredibly satisfying, and sort of kind of sometimes makes all of that suffering a little worth it. Like, it wasn't. I don't wish it on anybody. But that we have been able to take this this thing that happened to us that was so awful in ways that beforehand didn't even consider it was possible to be that sick and suffer that much. To be able to take that experience and turn it into something positive is extremely rewarding. But yeah, we've gone through a lot together over 4, 5, 6 years at this point.
That's a really interesting point there, as well as I've met people who have created, like you guys, created charitable type organizations, service organizations, who've written books, who have created organizations that raise funds to give out micro funds, for people to pay for medical or for doctor's appointments, if you will. And, you go through, or I've come to learn, you go through a real deep spiritual journey, I guess, to do that. Now, I always ask the question, are you happy that you've done that? Not happy, but no one set out to do that. Very few people have said,
Totally.
I want to get a disease so that I can create a charity to help other people.
You don't want this one.
But I like the way you talked about how you do have a choice. You can be a victim, or you could be a survivor. Brooke, why don't you give us your perspective as well?
Sure. Really hard to follow the beautiful answers from Jesse and Jennifer. So mine will be relatively simple, but there's something that happens when a new person comes to a meetup that I really like, and I think says something almost universal about this community. Those attendees of a meetup who have been to meetups before go out of their way to welcome someone new at the meetup and to do whatever they can to provide information or support. And so what I think that says about the strength of this community is it's full of people who have been through and are going through really, really complicated journeys with their personal health. But as part of that process, they really want to help other people. And as much as, we have struggled with our own conditions, it's clear to me through our work at Generation Lyme that there is a massive number of people out there who have been affected directly or indirectly by tick-borne infections that really want to work hard on solving this problem nationally and helping other patients and helping other supporters too. So that's something I'm constantly admiring of within this community, and it's very special to see.
Yeah. So that being said, what are some of the surprises that have come up for you? Again, you mentioned you've had over 10,000 people who've gone through the meetup. So what are some things that, besides creating the community, or now, as Jesse alluded to, being part of a community, what are some surprises that you see because of the participation that comes through the various people who participate in your meetups? Who wants to take on that question? Jesse, how about you?
Yeah, I'm happy to. There have been like good and bad ones. So like
Mm.
we've had one of the great things that we've seen is like people really connect with each other and become friends in real life, and how rewarding that is for our participants. I think having hosted a lot of meetups over a long period of time, the fact that like every new person who comes has the same story is getting old, right?
Mm.
Like at some point, I guess it's not even a surprise, it's just a disappointment, but like every person, almost every person has been sick for a long time and nobody can figure out why, and all their tests are coming back totally normal, and it's the same over and over, and they come in with the same shocked look, like they are the only person on the planet experiencing this. So it's really heartbreaking. I mean, we have people come to our meetups who are homeless. We have people who come to our meetups who can't find work, who are trying to get disability and they can't, who are fighting with their insurance companies and they can't. The amount I think I was shocked by how little we take care of our the people who need help the most. It's just really, even people from other countries who assume treatment is going to be better because it's America and we have great healthcare. It's awful. It's
Yeah.
just unconscionable the way the healthcare system and the medical system, and how just alone these patients are.
Yeah, those are themes that come up every other week on the Love Hope Line podcast. Jennifer, how about you? Any ahas that have come up for you, or any big surprises that come up through the various sessions?
It's a great question. I think mine would be a little bit different. My role here is very much on the kind of in the background and in the sort of organizational leadership and then managing background things, right? So I don't do meetups in the way that Jesse and Brooke do, but we manage the organization together. And so the surprises that I encounter are less in what people talk about at meetups, although I have been to meetups plenty of times. But it's in what happens when you start an organization and when you run an organization and when you grow an organization, and particularly when you're a member of the community that you're serving. It's an interesting experience. I mean, it's wonderful. It's also it's a lot of work. That's not a surprise at all. It's work that we want to do, and that's why we keep doing it. It's also interesting how the perspective of you as a community member and you as a group of three may change over time because you are leading an organization, and that's something to think about when you are putting yourselves in when any group is or any individual is taking on a position of leadership within an organization. How, no matter how big or small, you take on a responsibility of some kind of different persona, and that carries a different kind of weight with people. And so people have different expectations of you, and that doesn't really mean that we're special. It's just you run something that means something to a community, and you have to behave accordingly, because that matters. I mean, even whether it's us or other people running Generation Lyme matters to a lot of people because of the name, and that's important to us. And so that we're always discovering things like that, and every time we discover a new pocket of an area of importance, we really, really try to do everything we can to do as much right and as much good as we can. And so I don't know if that's as surprising as much as it's just a lot of growth, and we're always trying to keep up. And it's a challenge that we enjoy. It's just kind of like, I'm sure everybody who runs these things experiences it. We're in it too.
It's interesting, like Jesse had mentioned, we keep hearing a lot of the same things over and over again because of the lack of good diagnostics and testing. And of course, treatment is woefully implemented for most cases, and it takes them years. I spoke to someone today who said she was finally officially diagnosed after 25 years of fatigue and pain. And I'm sure y'all have heard that hundreds, if not thousands of times. And then, of course, sometimes people are thrilled that they're told, well, it's Lyme disease. Great, good. Where's my pill that I take to get past Lyme disease? And we all know in a lot of cases, that's the journey. Brooke, where do you go from here? So again, we're doing today's interview in April of 2024. So I presume you're not really doing live things right now, or are you? Are you going to get back to Lyme, or what are some of the things you're looking to add on as the year and as we get into the next year or two?
Yeah, absolutely. As Jennifer mentioned, we are constantly kind of discovering, based on patient needs, other ways, like more ways to serve this community. So a couple of quick answers there. As I mentioned earlier, and Jennifer and Jesse have helped to lead the organization on this, we have our own podcast. So we have done almost 20 episodes of the Generation Lyme podcast. And as I'm sure you would agree with, this is a great way to share information and to support members of this community by kind of dispensing knowledge that we have, and talking about trends or important topics to tick-borne disease patients and supporters. So that's one thing. We're obviously going to keep doing meetups. I have to mention that we do have this incredible group of about 20 volunteers who host our meetups. But for anyone who's out there who likes the idea of hosting a Generation Lyme meetup, please feel free to be in touch with us. We're always looking for volunteers, and we're happy to provide training and share what we've learned about hosting meetups. So that's always a way to be involved. And I have to credit Jennifer for a community event that she helped to initiate a couple of years ago called Generation Lyme Day. This is something that she really spearheaded. It is a holiday that Jennifer helped our organization create to celebrate people who just exist and are dealing with tick-borne infections. And it's a really incredible event that we've hosted numerous times just to celebrate the people who are here and have had Lyme or other tick-borne infections. It's an amazing experience.
All right. Once again, I want to thank I mentioned the founders. I guess you're not technically the founders, but the leaders of Generation Lyme, Brooke Stoddard, Jesse Rubin, Jennifer Hoffman for the insights today. And I just want to acknowledge this again. Like I mentioned, I didn't know prior to the research I started for my book, Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. I had no idea they were communities. And I'm a very well-networked person in all the worlds that I am. And I knew of a ton of things, but I didn't know there was anything like this going on in the Lyme world. And I didn't know that there was a need. And I didn't know that people needed to come together because most people don't understand what they're going through. That's why I wrote my book. That's why I created the Love, Hope, Lyme podcast, is because I met so many people who said things like that. It's like people don't understand, even people that are closest to them. People who are sharing a bed in many cases don't understand exactly what they're going through. So I just want to acknowledge the three of you for the community that you built, the services that you're bringing, and the way you talk about what you're doing. It's being said with care and love and empathy and compassion. And this is definitely a community that struggles with empathy, love, and care and compassion. So thank you for bringing that to so many different people. Just want to go around the room one final time, give each a chance to just kind of say a final thought. Maybe the context is, what is the best way for people to get value from your offerings? You mentioned before, people might be a little bit reticent to show up. What would be your advice for someone listening to the show today or watching it on YouTube who has never come to a community event or who's never come to a meetup with other people who are in the Lyme community? I've met people who have said, I want nothing to do with the community. I'm going to figure this out on my own, or, I don't want to talk to other people with it. And I talk to people who their life has become service to the community, however they're doing it. So let's kind of zip around. And first of all, once again, I want to thank you all for being on the show and for what you're doing. Give us the answer to that question. Final thought, best way to get value. And Jesse, why don't you go first?
I think the thing that makes us unique as far as Lyme organizations is there are a lot of groups that are raising money and trying to find a cure and focusing on research, and that stuff is super important, obviously. Our mission is how can we help Lyme patients right now, this second? And that was really something that was missing and really our mission. I also used to think like, I don't want to talk to anybody. I don't want to burden anybody with this. Nobody understands what I'm going through. And we have seen time and time again how helpful it is to connect with people. So there are people who come and they just listen for months. And then they come camera off, but they're talking. And then they turn their camera on and they're fully participating. And it's just amazing to see that change. And if you're hesitant, but you feel like you might need us, just come check it out. We got meetups all the time. We're really nice. And we get it. We just get it. You're not crazy. You're just not. And so many people feel like they are. So if you're listening to this, if you're sick, come to us. If you know somebody who's sick, send them our way. We can help them. And there aren't that many organizations that can.
Very good. Good distinction there. Brooke, why don't you give us your thoughts?
Yeah, certainly, two themes have come up today. So I'll just kind of readdress them. But for anyone who's listening, who feels a sense of loneliness, or if you don't feel like you have people around you who really get what you're going through, Generation Lyme tries really hard to address those two issues. And we have talked about both today, but, all of our services are meant to help people going through the experience of tick-borne infection. And so if you are, dealing with either of those two things personally, we hope that Generation Lyme can help you along the way.
All right, very good. And Jennifer, why don't you bring us home? Give us a final thought to wrap us up nice and strongly here.
I'll do my best. There are so many ways to be part of the Gen Lyme community, whether you're a regular meetup participant, whether you come one time, whether you are just following on social media, visiting our channel sometime, if you listen to the podcast, if you get our emails, if you read our blogs. We have blogs for patients and supporters, which are full of tips, whether they're practical tips about actions to take or things to consider emotionally. We also have these community events.
Those are great. Thank you so much. So once again, I want to thank the leaders of Gen Lyme. My name is Fred Diamond. This is the Love, Hope, Lyme podcast.